We're really excited about the Rectal Cancer Accreditation. We're the first program in the state to receive this national accreditation. What it really means is we're accredited by the Commission on Cancer from the College of Surgeons for our whole cancer program, and there's very strict criteria to get this accreditation. We worked hard to get it, and we're very pleased to pass on the first course, and it's exciting for us.
Rectal cancer is a very, very complicated disease, and the treatment for rectal cancer has been evolving year after year after year. What our facility offers as an accredited center is a center that has gone under an in-depth review process, and that ensures that we can't just say we're the best, we truly are, and that we had a third party come and look at our program and confirm that we're doing everything as we should.
When somebody is diagnosed with any cancer, particularly colorectal cancer, it's overwhelming. It's life-changing in more ways than one. So the last thing they need to do is figure out when they need to see which doctor. Our team approach includes 3 different specialists. So that is surgical oncologists, who are colorectal surgeons, the radiation oncologists are radiation doctors, and the medical oncologists are the cancer chemotherapy doctors. In addition to that, our program also includes genetic counselors as well as our nurse navigators.
My role as a colorectal nurse navigator is really to be an advocate for patients and their families. I often say I'm the glue between the pieces, all the specialists that we have. I have access to physicians, and I provide resources, education, emotional support.
Karen is our umbrella person. She's our point contact person when you don't know who to call, what's wrong.
She's often the first point of contact if a patient calls in or a referral is made. She collects all the data, really manages the patient's whole course.
You know, they wear many hats. They can also be counselors to our patients.
And she's just a great emotional resource for someone going through all of these treatments.
In our program at Franciscan, we see patients from around the state and often in the Midwest generally. And we always try to make life convenient for anybody. The advantage of the program is that patients can come here, we can review the cases, but we also understand that if you live 2 hours from Indianapolis, you don't want to be spending your whole life in Indianapolis getting your cancer treated. So that we have connections and affiliations with a lot of hospitals around the state. Ultimately, usually the surgery is done here because of the expertise of our surgeons, but a lot of the other treatments can be done closer to home.
And we feel very strongly to make treatment as convenient as possible for patients. So if it requires them to have chemotherapy close to their home or have radiation close to their home, we take great effort to making sure that we collaborate with those doctors no matter wherever they are and ensure that all the communication is up to date. So rectal cancer accreditation has only been around just for a few years, and as soon as we heard of this possibility, we immediately began to lay the groundwork down to get our institution in position to get this accreditation. We have 2 convenient locations, both located on the south side of Indianapolis, one located in Indianapolis and one located in Mooresville. And as a result of that, we are the only institution in the state of Indiana who has been accredited for rectal cancer, and we are only the 19th program in the United States to have this accreditation.
Rectal cancer care is very specific, and it's different than colon care. And the accreditation, I think, just shows that we're a cut above everyone else. We are doing everything at the highest level and are holding ourselves to those standards.
Over the course of our experience with multiple cancers, we now realize that when something is held to a national standard, that improves the outcome of care for our patients. But that care is going to be consistent across the board for all our patients, so every single patient will receive the best care possible according to national standards.
About 10 years ago, we were accredited for our breast-specific program, and this is the newest accreditation that's available to us, and again, we're the first to have it.
You know, Franciscan Health to me is the complete package. It's like getting big city care in a smaller community, and what we offer here is a personalized touch, and we offer really this collaborative effort so that every doctor who you see here at Franciscan Health is committed to helping you beat the disease.